Let's move through some of the most important cervical vertebrae. We begin with C1, the atlas. The atlas is the first cervical vertebra, and it is completely unique. Unlike other vertebrae, it has no body and no spinous process. Instead, it forms a ring that supports the skull. On the superior surface of its posterior arch, there is a shallow groove. In this groove, the third part of the vertebral artery travels along with the suboccipital nerve. Next is C2, the axis. The axis is easy to identify because it carries the odontoid process, also called the dens. This peg-like projection fits into the atlas and creates the pivot that allows you to rotate your head. Now, a very important clinical condition related to C2 is the hangman's fracture. This injury is a fracture through the pedicles or pars interarticularis of C2 on both sides. Moving down to C6, which is an important surface landmark. At the level of C6, two major transitions occur. The larynx becomes the trachea, and the pharynx continues as the esophagus. Also, the anterior tubercle of the transverse process of C6 is called Chassagnac's tubercle. Clinically, this tubercle is used to palpate or compress the common carotid artery, especially during procedures or to control bleeding. Finally, we reach C7, the vertebra prominens. C7 has the most prominent spinous process in the cervical region. You can easily feel it as the big bump at the base of the neck in the midline.